Hello, my name is Mia Navarro. I will be the student nurse that's going to change your Cvad dressing here. Before we get started, I do have a couple questions for you. So first off, I'm going to ask you for your first and last name. Nice to meet you, Gabriel. Also, I want to know your birthday. And let me go ahead and check your armband. Awesome, that matches. Okay, so before we get started, I do have a couple more questions for you. So first, do you have any allergies? Okay, any pain at all? Okay, and then have you had this procedure done before? Okay, good. So that means you have a pretty good idea of it. Do you have any questions for me before I get started? Okay, awesome. So I'm just gonna place my supplies at the foot of your bed. That's okay, thank you. So I did hand hygiene for 20 seconds, and now I'm just gonna prep my area for a sterile field. And to do so, I'm just gonna wipe down my area for 30 seconds with a chlorhexidine wipe. I know, usually these gloves don't give me this much of a hard time, but every batch is different, I guess. Thank you for your patience though, Gabe, I appreciate it. Okay, I'm just gonna wipe this down for 30 seconds. 1, 2, 3. Okay, now that 30 seconds has passed, I'm gonna go ahead and let that air dry for 2 minutes. And now that 2 minutes has passed, I can go ahead and open my package. Before I do that, I'm just gonna do some hand hygiene since I got my gloves off, so now I wanna do hand hygiene. Okay, let's go ahead and open this. So here I have a mask for you, Gabe, and this is just gonna prevent any infection. So you can go ahead and put this on. Thank you. Okay, I'm also gonna have you turn your head opposite of where the site is. So since the site is on your right side of the chest, I'm gonna have you look to the left. Okay, Gabriel? That's perfect, thank you. I'm just gonna drop in my bio patch. Okay. And now that my supplies are ready, I'm just going to do some hand hygiene again and put on another set of gloves. It's not gonna be sterile gloves yet, but I'm gonna put another set of gloves on to take off this old existing dressing. For 20 seconds, of course, my hand hygiene. Okay, so just looking at your site, well, the catheter does look like it's at the previous position as documented, and the length as well is the same. And then once I get into your site, I'll be able to see if there's any cracking or leaking and anything of that nature. Okay. So these tegaderms should be pretty skin friendly, or the dressing should be pretty skin friendly in terms of it shouldn't pull at your skin too much, but if it does, if you experience any pain, go ahead and stop me. Okay, I'm just gonna start off by taking off the secure tape on the end here. I'm just gonna secure the and I'll just take off this old bio patch here. Awesome. Okay. So I'm not seeing any redness, swelling, or bleeding or drainage at the site, which is awesome. And also, the ports are closed, which is great. And I wouldn't tell this to them, Linda, but the port should be closed so that we don't get any air embolisms. Okay, and we have a cap on there. That's awesome. No cracks or breakage in the tubing. Great. Okay, so I'm just gonna go ahead and clean your site, Gabriel. And to do so, I'm gonna prepare by doing sterile gloves. Let me do some hand hygiene first. Okay. Luckily, I didn't open the package all the way, or else I would have had to get a new one. Okay. So after hand hygiene for 20 seconds, I'm going to go ahead and put my sterile gloves on. I'm just going to fold over my Tegaderm. That'll make things easier for me when we get to that step. Awesome. Okay. So now I'm ready to, I'm just gonna put this a little bit closer to me. Okay, so now I'm ready to go ahead and clean your site. While I do so, don't hesitate to let me know if anything becomes painful. So I'm just gonna clean the site for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 10. Awesome. I'm just going to dispose of this, and I'm going to let your skin dry for 30 seconds before I go ahead and apply the new bio patch and the new Tegaderm. Okay, now that that has dried, I can go ahead and apply your new bio patch. Perfect. And now we're ready to apply your new dressing. Awesome. Are you experiencing any pain at all? Okay, very good. I'm just going to go ahead and secure this down and get rid of as many air bubbles as possible. Okay. And then I'll just take off this border here. How was that experience? Good? Okay. Okay. Lay that nice and flat for you. Okay. So now I'm just going to get this piece of tape here to secure that ending tube furthermore so that it doesn't go anywhere. Very good. And then I'm just gonna get this piece of tape here and a pen and just write down the date, initials, and time that I changed your dressing. Okay. Awesome. Okay, Gabriel, so I'm just gonna clean up my area and do some hand hygiene. Okay, so while I clean up my area, I just have a couple questions for you in terms of documentation. So, did you experience any pain during that? Okay, good to hear. And so I have to document that the patient tolerated the procedure, and that is true. Awesome. Okay, so I'll go ahead and document those things, and also the time, date that I changed your dressing, and that for me personally, I did not see anything during my assessment in terms of draining, bleeding at the site. So yeah, I think that does conclude my procedure. Before I go, do you have any questions for me? Okay, awesome. It was nice seeing you, Gabe, and I'll come around in a bit to check on you. Thank you.